Social Democrats.
Thanks, Alaska Corley. Minister, I agree that the vaccination programme has the potential to be transformative, but only if it operates properly. And I don't have confidence that it is going to operate properly. I think probably for the 6th week now in a row, I'm asking you, will you publish a plan for the rollout of the vaccines? I agree with the points made earlier. Sometimes you wonder, what is the point in coming in here on a Thursday morning? I've lost track of the number of notes I've been promised. It's not possible for us as opposition spokespersons to get answers to questions. You don't provide them. There's no other way of getting answers either. The HSE has no service in relation to that. So it's very unsatisfactory, the whole thing. But my concern is that we don't have a published plan for how we're going to roll out the vaccines at scale. And, the memory is very clear in relation to the promises that were made in relation to testing and tracing. And that plan didn't work out, and there were lots of problems with it. So as of now, we have a situation where the average daily number of vaccines being administered is 18,000. That's on a 7-day average. So it's 18,000. When we get to the point, in a few days' time, where we're getting nearly 1 million doses in the month of April, we will have to increase the daily number of vaccines to 33,000 per day. That's nearly doubling of the maximum that we've done now on an average basis. When we get to the point of June and July, if what the Taoiseach said is right about the expected number to be delivered, we will have to have the capacity to deliver 50,000 vaccines per day, to administer 50,000 per day. Now, at this rate, we're into April now today. There is no plan. Pharmacists, for example, have no idea where they fit into the plan. We know that CPL had to extend the recruitment date because they haven't recruited enough people. We know that there are many, many problems in relation to the long, convoluted application process that has been done. Why haven't they been sorted out? Why are we still asking well-qualified doctors to produce their Leaving Cert results? I mean, this is just ridiculous, Minister. You have to cut through that. Anybody with a medical qualification is registered with their professional body. So there should be no question of going back, years, checking out different aspects of their qualifications. So can you cut through that? I don't have confidence that we'll have the capacity to deliver at scale in the coming months. And you need to assure us that we can have that confidence, but you've provided no evidence of that whatsoever. My next point is in relation to allegations on queue skipping in relation to the access to vaccines. We've already had standout examples of that with the Coombe, with the Beacon, with the VHI, and they're so dispiriting for people. But there are also allegations about many people within the HSE, healthcare workers who are not front-facing and who are working from home and have clerical jobs getting ahead of other people who should be getting the vaccine. So can we have an audit of who has actually got the vaccine within the health sector? I'm not satisfied about that at all. My third point relates to those people who have a serious underlying health condition, both in terms of people who are at high risk and very high risk. Now, the very high risk people, there are 160,000 of those in that category. Only 30,000 have got their vaccination to date. How are you going to identify the others? And when are you going to develop a database that will ensure the rollout will take place quickly over the next few weeks? The same questions apply to people, of course, in relation to high risk with underlying health conditions. My final point is in relation to, and I'm just making these points to you, my final point is in relation to the recategorisation, the reprioritisation. I fully accept evidence in relation to these matters, and decisions should be based on evidence. The evidence we have so far is that age is the single biggest predictor when it comes to severe outcomes, not in relation to risk from exposure. And that is the key difference. So has any study been done which supports the prioritisation that relates to exposure as opposed to severe health outcomes. And if you could send me those replies, I would appreciate it, Minister.